Welcome back to Medfluencers Unscripted. Today we had an incredible conversation with Dr. Bayo. All of that is coming up. You're not going to want to miss this, so stay tuned. Of course, I am joined by Jordan. Jordan, welcome onto the show.
Hi, guys. Yeah, it was an amazing episode today. Dr. Bayo is human sunshine. We really dive deeper into a lot more of her personal story, how she got her start, and her why for everything she does in medicine. So it's really motivating. Definitely don't want to miss it.
All of that and more coming up, so stay tuned. We'll get into it. All right, Dr. Bayo, thank you for joining us on the show, Medfluencers Unscripted. We are so excited to have this conversation. I know it is always a joy and an uplift to my day speaking with you. We're super excited to have you. Thank you again for joining.
I am excited to be here, Dr. Adam and Jordan. Both of you are just wonderful people in itself, and so it's fantastic to have a conversation. So I'm glad to be here.
You are brightness in both of our days. You're amazing. We're excited to do this. Dr. Bayo, if you don't mind, I really want to take it back to the beginning and hear about like your childhood, where you grew up before you're starting all of this.
Jordan's
really want to take it back to the
very excited for this question because you're such an incredible creator with such an amazing story. And for those who don't know and have heard in the intro, Dr. Bayo is a TED speaker, world-renowned speaker, really, for all things healthcare, news correspondent, an amazing social media creator. But what fueled that fire?
There are many elements to what has fueled my fire and what continues to push me forward. And so I was born in Reno, Nevada, and I'm a family medicine doctor, but I also practice urgent care, and I'm also the medical director for a sexual assault response team. And when I really frame how I'm a part of so many different things when it comes to healthcare and advocacy, all credit goes to my father, William Curry. And he was 99 years old. He was a World War II Korean and Vietnam War veteran. And he is my reason why I do what I do every day when it comes to advocacy, when it comes to community involvement, and when it comes to knowing that there's work beyond myself and there's an opportunity to help people in different ways. And I grew up going to different events, different rallies, and I remember holding up signs, being at these amazing things, but not knowing why I was there, but knowing I was standing up for something. And that has become my blueprint. And it is what fuels me, Dr. Adam, every day, because I think about what he went through as a Black man who was part of a segregated war. And his motto was, even when things were terrible, what can I do? What is the solution? Always looking for that positive piece. And that's what I incorporate in my life. And whether it's with my kiddos as a mom, I'm a wife, a doctor, all of those pieces, it's all about what can I do to help someone else? And that is really the fabric or what makes me who I am.
That's incredible. There's a lot of talk around, in medicine at least, that people learn from and people connect with better folks who look like them, right? It's the importance of diversity in healthcare. As a Black female physician, going through your training, now practicing, now being on social media, how does that drive your engagements? And do you find that you're seeing that connection from other communities that maybe others aren't reaching?
I do. When I think of the statistic that Black female physicians make up 3% of the overall physicians in the U.S., although the overall Black population is greater than 14%, that's another piece that is a part of my story and why I do what I do. So yes, I want to get health information out there to the general audience and hope that people can feel informed, engaged, and feel like they can do something. But I also have this just drive to really improve representation, because you don't see people who look like me on social media, on television, all of these mediums really as the majority. So if I can really help bridge that gap, because when we talk about inequities and disparities, and we know that specific groups are impacted, specifically groups that look like me, I can lend just a little piece by being a doctor and a Black woman. Those two pieces, I think when we talk about health literacy and advocacy, it's really representation as a part of that story. And that's why it's important to me to be in those pockets of social media, on television, all of those areas, because people often ask, why do you spread yourself so thin? Well, it's easy for me to say because I know that people consume information in different ways, and there's an ability to reach people not only through their minds and their hearts, but also what they see. And if I can help in any way, I'm all in.
You're absolutely on to something. And I think, it's interesting. I'll leave the name of the company out. And they did nothing wrong, but I speak for some pharmaceutical companies and on innovative technology that's coming out, right? And they release the data, any of the speakers in a KOL program, they get the data, they make their lecture, and they said, we'd really love if you could touch on the disparities of healthcare here because we think this is really groundbreaking. And we're in a room and I said, you don't really think this is groundbreaking, right? Like the sad part is this statistic for every drug that comes out, because it says, okay, they marginalized populations, Black and Hispanic folks are not getting this particular product that they should as part of screening guidelines. I'm like, this is not new. This shouldn't be that I'm touching on the point. It should be, how are we fixing this at a larger scale before we've gotten to the point where I'm now talking about a medication that's coming out and, oh, well, we have this data and we know that we're not reaching. Like, I think what you're doing really starts to reach where it matters across America. So kudos to you. Hats off on the effort.
Thank you. And that's the part, we notice when there's, whether it's a pandemic, whether there's some sort of data that comes out, there's this reactionary piece like, oh, well, how do we do this? Well, if you can start from the root and really build trust and have a level of authenticity to your message, there's an opportunity to help those groups. But just by being reactionary or just saying, oh, this is just what's supposed to happen, I don't subscribe to that. Yeah. I think there's an opportunity to really move that needle in a way that is centered with trust, with understanding, and the ability to say, okay, this is what we can do, and this is how we get there.
And I think you touched on some with the trust. There's so much noise and clutter out there. And I do think that's why your community is so engaged with you, because they feel that authentic connection to you. Yeah. And I think that's what makes it really, really special with what you're doing online.
I appreciate that. I really take the time to think about, how can I deliver this message in a way that isn't talking at people? It's a conversation. It's where I share all the information, but in the end, you are the driver's seat. You're in the driver's seat, and I'm here just to share and help you along that road. But again, you are the anchor. And I think if we can flip the script on how we have that dialogue, that narrative, that messaging, that is how we're really going to be able to make strides.
I love that. Flipping the script. I'm going to take that one. I really like the way that you incorporate that. Now, I'm really curious to lean in. You do a lot with traditional media on TV. You're now grown quite large on social media. And, we've known each other for some time, and it's been amazing to watch you, gain traction. Can we compare and contrast those? And particularly, I'm wondering, you can reach so many folks on their television set. Why spend the time on social media? How is that a different experience for you? And how is the end goal or outcome different in the way that comes together?
For me, I really feel like, well, I think it goes back to even just my personality and who I am. I've never been one person who just does one thing. I always believe in doing it in different ways. And the reason why is because then you can touch more people, you can reach more people. And my dad always told me, all of us listen or take in information in different ways, or we use different tools and techniques. And that's why I find joy in this cross-pollination of legacy media, regular media, and social media, because I know there's an opportunity to touch more lives and be able to share the information more broadly. And so whether I'm on television and I'm talking about a topic, I'll use that and I'll put it on social media, or vice versa. Why? There's more people to share it with. And then I think about, if someone saw it on TV, maybe they're going to possibly share it on social media. And for me, it's not about me personally being shared. It's about the information getting shared.
Yeah.
And that's why I invest in the social media, because maybe then, that person may hear it on TV and they'll say, oh, I remember seeing this on social media. I want to dig a little bit deeper. I want to learn more. Maybe this is something I can do for my health or for someone that I know is facing a health challenge.
Amazing. You mentioned folks may see content, they may share it on social media. You've built quite the community. Do you find that those national hits, those news story pieces have strengthened your community, have helped people to find and identify you? And do you see almost inter-community interactions, or is it more kind of one-off experiences? What is your personal experience with that?
I see this lovely interconnection or web that has happened. There is, people will see it on television and then possibly find me on social media or vice versa. But the information, and I'll do this because I think this is a great example. Often we know that in order for people to understand information or take it in, and even myself, sometimes we have to hear it like 2 to 3 times before we're like, wow, oh, that's what that person was saying. Even studying, I've been like, oh. And so that's why I think the two have worked really well, because they'll hear it on this and then I will take the time to put it on social media. Or often media will reach out to me and say, I saw this post, Dr. Bayo, will you come on this network and talk about it? So that's what I've been seeing and continue to kind of just put forward.
That's awesome.
I would imagine on social media for you as well, you probably have amazing stories of just the engagement, the constant interaction with the community you've built, and your DMs, comments. Do you have any stories that just stick out to you of people being like, Dr. Bayo, I saw this and this made me do this and it helped lead to this, or I went to my doctor because you talked about this? I would be really curious. I always love hearing these feel-good stories.
I do. So one that sticks out is a gentleman with Parkinson's disease. So I actually did a little social media post, and on my podcast, I talked to this amazing couple, and Mr. and Mrs. Coley, and his wife has Parkinson's disease, and they're African American. And we talked about the journey of Parkinson's. For those who don't know, it can take sometimes 7 to 12 years or longer to get a diagnosis. And for those of us, as you know, Dr. Adam, in med school, we there's a picture of what Parkinson's disease looks like, and it doesn't look like someone that looks like me. And what was so powerful with Mrs. Coley's story is here she is, a Black woman who had all of the symptoms, the traditional symptoms, but unfortunately the image of what Parkinson's looked like didn't fit. And that clinician didn't have that part of their differential diagnosis, meaning all the, different diagnoses that we think of in our head. So having her on the podcast, sharing the information on social media, I had a person reach out and DM and say, you know what? Like, I think this is what my mom has. I'm pretty sure. And by hearing Mrs. Coley's story, I'm going to have her get checked out. And then a couple months later, I got another DM, and that was the case.
Wow.
So, those are the stories that help people see themselves that they may not be able to in a clinic when they go and they see a patient or see a doctor. They may not be able to say, oh, this symptom is happening, or kind of just think it's not that big of a deal. But if they can see themselves in a story, whether it's television or social media, that's when the magic happens. And another story I can't help but think about that happens every time. So I speak across the country, as you know, at different events. And when I share my story about what happened to me during my pregnancy journey, every time I have a woman who will reach out and share, I have this family member, or I'm pregnant, and now I have these tools to advocate for myself when I deliver. So again, and that's, why all of these different opportunities to share health information really leads to the opportunity to help more people.
Absolutely. I want to come back to the maternal health journey, but I want to hit down on something that you said, which was really important. And we run into this all the time. It's interesting for those from industry that listen. Dr. Bayo was mentioning Parkinson's disease, maternal health. We've talked primary care. these are all areas that you have followers and people that are interacting with you. And there's this misconception that, well, we're going to talk about Parkinson's, and so we have to have a neurologist, right? I
Yes.
think that is completely wrong. And we spend a lot of time kind of dispelling that rumor, but physicians are experts in medical knowledge translation and communication. We work across disease states, and especially emergency medicine, primary care, urgent care. They're all internal medicine, right? We touch very different areas of medicine throughout the day. So yes, a neurologist is going to write a paper on something, but you've had a tremendous, literally life-changing experience for someone from something created on social media, and you're not a neurologist.
Yeah.
And that's okay.
That is correct. We are missing the mark on understanding basically how patients seek care. And as a primary care physician and as an emergency medicine physician, as you mentioned, we are the anchors.
Mhm.
And I think as a primary care, the phrase I like to say is womb to tomb. I see
Yeah.
everything, and people are surprised. I'm like, yes, I've delivered babies. Yes, I've assisted with C-section. Yes, I see little people, and I
Right.
see older people. And there's this notion that no, it has to be a specialty to talk about it. Well, when you look at all the things that primary care and emergency medicine, what we see on a daily basis, even mental health, we are your go-to.
Right.
We are your
Right.
person who is really helping that person navigate and diagnose and go from there. And I did a talk recently, a couple of months ago, where I highlighted that, where I've been able to work with different organizations and brands that took a non-traditional leap of thinking about, no, I'm not going to hire this specialty, because you know what? Primary care is
Right.
where it's at, because you do see all those things.
Yeah. I'll say we're seeing that, and Jordan can echo this, but we are seeing a significant increase in interest from, industry as a whole in bringing primary care into the conversation. And for those that are unaware, the way that pharma and device and those industries track success is they look at those folks who are directly involved in the care, what they would call KOLs, people who are writing medications, those type of things. But the truth is, a lot of folks are accessing care outside of those traditional specialty areas, right? And we are missing the mark, as you said, on reaching patients where they are, and actually, frankly, reaching other HCPs as well, right? 80-something% of physicians and other healthcare professionals are not in traditional academic centers, right? They're out in the community practicing. So are we really reaching them by having a KOL, write a paper or give a talk at a small closed room event? And I think, we've got plenty of interesting numbers around that, but it's funny that it continues to come up because, and it's great to hear that you're experiencing that as well, that, industry is starting to take an interest in, okay, maybe we don't have to link this directly to a provider, but we know there's incredible impact that can be done here at a primary care level.
I agree. There's something to be said about, yes, academic medicine, really has this kind of structure and this notion that it is the prestige or the best. But for me, it's like, I'm seeing patients that are of all social economics. I'm in the community. I'm actually a part of the care.
Mm-hmm.
And I think we feel that we have to have this specific Ivy League sort of kind of hospital training or med school training to feel like then that work can really uplift and make a difference. But no, it's really the people who are seeing these patients every day, who are in the trenches, who are part of these communities. That's where I think the credibility, the authenticity should lie, not in a paper, but in those who can deliver the message in a way that people feel heard and they feel comfortable sharing their information and receiving information.
You mentioned earlier advocating for yourself, advocating for patients. In a world where AI and technology and all of these components, right, they're evolving incredibly fast, making access to care better, helping folks identify. And I'm sure you've had this. I've had patients come in that go, well, my Apple Watch told me I'm an AFib. And you get the EKG and you're like, yeah, you are an AFib. It's great. What has been your experience with wearables, especially now we see, continuous glucose monitors for non-diabetics are coming out. There's new patents being filed for, Oura Ring just announced a big partnership. There's lots of interesting things in the wearable space, but how do you see that fitting in terms of access to care and quality care?
I think it's going to be vital when we talk
Mm,
about how we move forward. Wearables are the key. It really gives us this inside look or optics into what is happening. But I can't help but still think about the gaps or those who are left out that may not be able to afford
that's
that
what I was just
wearable.
about to say. Yeah.
And so that is something that we shouldn't really put all of our focus on. Because when I think of AI, when I think of wearables, not everybody can afford it. And then I'm going to go a little bit deeper. When I think of AI, yes, it's a great step in the right direction as far as being able to broaden our reach with
Mhm.
diagnosis and different things, but it doesn't take away bias.
Right.
And that's something that I am very passionate about, that bias exists everywhere. And although you can have this amazing tool and technology, it can't um, substitute for the fact that bias is part of that fabric. And
Absolutely.
also, the person who delivers the information that they were able to get from the AI has bias as well. So I think there's opportunity, but we can't forget the foundation and make sure that we interlace this kind of check and balance. Is bias a part of this? Is a race-based algorithm a part of this? All
Yeah.
of those things need to be addressed.
Yeah. Dr. Bayo, I'm curious. So you touched a little bit on working with different brands and organizations. How do you feel like that helps further your mission of what you're doing on social media? And how do you go about that to make sure that it's going to be authentic for your audience and all of that?
Well, first, whenever I have a brand that reach out, I think about, is this something that I would use? Is this something that I believe in? Because for those who know me, when I believe in it, when I'm passionate, it pours out in all
Yes.
areas. In my voice, my mannerism. And so if I feel like this could help someone, I'm all in. And then I think about, okay, the message, how would I use it? How would someone, what questions? And sometimes it's an unpopular kind of thing to think about, where I will highlight, certain things that aren't often part of a topic that we don't talk about, but I know my patients are curious about it. And so that's where I try to make sure that that's part of that messaging with that brand. And if they are fine with, putting that out there, then I align. One great example that we had, Jordan, and you know about this one, was I'm really passionate about equity and then advocacy, but also thinking about topics that are sometimes pushed upon patients that they don't have to partake in. A good example is weight.
Mm.
Weight is something that often when you go to the doctor, people feel like they have to be weighed and they don't want to be weighed. And so when we had this brand that shared, oh, we've got this great system and this great, scale, it was really important to me to say, if I'm going to do this, I want to do it in a way that how I practice care, how I would want to hear this message about how this tool can help me, and not be based on a number.
Yep.
Like, that part was important. And they were like, yes.
Yeah.
So as long as we can have that healthy conversation about it, then it's perfect.
That's actually, and we typically stay far away from controversy. I don't think we're going to go too close to it, but I am curious, and we'll keep it in the unbiased. So I won't talk about that product because they have a really interesting feature that prevents you from looking at weight if you don't want to. But how do you feel? Where do you feel the line is? And if you prefer not to answer, we can always sidestep. But around the selection of what you do and don't want in your care, to where it starts to affect your ability as a physician to make the right decision, and that at the pediatric level, right, we can lean towards vaccines. At the adult level, on the very surface, we can talk weight, but does it go deeper than that? Like, where does that element of choice lie, and does it all just come down to true shared decision making?
I think if, as clinicians, if we can really think about, when we decided to go into medicine, of course, we think of that term, do no harm, but we also have to remember that it's about the patient and not about us. And when we think about that, that's where we have to, yes, we want to do the best for our patients. Yes, we want to make sure they have all of the opportunities. But if that's something they don't want to do, we are doing more harm than good when we don't honor that.
Right.
But then we're also missing the mark if we haven't done our due diligence in sharing the information in a way that is digestible, in a way that they can understand all areas. And as we talk about the weight situation, I share with my patients, the only time I really need to know your weight is if you're a pediatric patient, if you're having surgery, if it's a medication that's weight-based or dosing, those are the things when I need it. But if you're just coming in for a checkup and you don't want to be weighed, you don't have to. And I think providing that kind of discussion point is shared decision making. And we don't talk about that in medical school and in residency as part of our discussion point.
Right. I think unfortunately in the health system too, there's this, emphasis, rightfully so, on litigation and risk, right? And there's so many folks that I see that I think kind of get lost or get it wrong in that. And I think we're probably more comfortable because we work in a setting where people do leave, quote, AMA, right, against our medical advice all the time. And that's their choice. And it's something that we, learn to grow comfort with and make sure that we're having comprehensive conversations with the patients. But I think it is, really important what you said right in the beginning was it's about the patient. It's not about us, right? So we may want to check all the boxes, but as long as you've done a thorough job, you've spent time with that patient, you've said, look, I can't tell you that you're not having a heart attack without these labs and without the EKG. I just can't do it. Visually, you look okay, but that is not the standard of care. However, and this is not legal advice. This is just like a sample conversation, right? But it's like if someone's like, I'm really scared, I want to leave, I will come back. I just don't want any more. We're doing more harm, right? We're health anxiety. We're holding someone against their will, right? There's a lot wrong there. And it feels wrong as a physician because you're like, no, I've been trained to check all of these boxes. I must have these results to discharge. But it is about the patient. It's not about us. And it is a tricky balance there. And obviously, we can't all live in a fantasy world and there has to be balance there. But I appreciate that answer. It's about the patients and it's not about us.
Right. And we know once you document that if that patient doesn't want it, you have done that protective piece, that really reducing your risk level, because then you have done what the patient has asked you to do. Let's think of the flip side. If you were to push forward and do all the things that the patient didn't want to do, I'm so sorry, my alarm. I apologize. Problem. I'll say that sentence over again. There we go. We have to think about, I'll start from there. We have to think about if we were to push forward and not honor what our patient is saying and asking for, that is actually harmful. And that's not providing good care.
Right. In some, and again, no lawyer whatsoever, but it is almost like battery, right? If you're doing things that someone doesn't want, that in itself is inappropriate, almost to a legal level. So,
correct.
There's a complex discussion here. And Jordan, I know you're not in the medical world, but there's this discussion of competence and whether someone can or can't make decisions. So it gets really nuanced. It can be really challenging, but it is a really interesting problem that comes up probably every shift for me. I don't know about you, Dr. Bayo, but on almost every shift, someone wants to do something that doesn't fit the standard. And folks, especially nurses, are very guilty. They freak out. It's like everyone's gone nuclear. The person is committing a crime, and it's like, all right, let's just have a conversation, see what's going on. Like, what's the interest level of why we don't want to do this? So it's a nuanced situation for sure.
And what I do is when that happens, I lean into curiosity. I think curiosity is also part of my secret sauce, and I really frame a question and I say, tell me more about why you don't want this test. Yeah. Tell me more what your concern is. Because when you lead with that, it allows that patient to feel like, oh, they want to hear, they want to know. And sometimes that's actually helped change the trajectory of what I've been allowed to do for that patient by leaning into that. And that is what I do with all of my conversations not just in healthcare, but in life. Yeah. And it has opened up so many doors where I've been able to learn more about people. And even if we agree to disagree, I now have this I've opened the door to have a conversation versus a barrier. And I think if we can incorporate that and spill it over into our healthcare discussions, that's how we're going to also be able to advance not only just care in that exam room, but beyond. And I think that's why when I think of why I created Beyond Clinical Walls, because that's really, putting that healthcare beyond the traditional walls.
Yeah. I'm so curious. I'm backtracking a little bit. This emotional roller coaster, we'll say, you have to navigate with patients. Do they give you the tools in medical school to navigate this?
I would have to say probably not.
I would agree. I would agree. Yes.
Just me totally.
I'm like, no.
No.
There was this more of a straightforward, this is X, Y, Z, this is what you should do. And I think that's kind of carries through even when you're practicing, where you feel like you're in a box. And I always felt kind of an outsider because I'm like, no, there's so many other ways we could do this. Why not this? Why not that? And Jordan, when you talked about my story, it's interesting because when I shared about, my dad and why I do what I do, I've been questioning different algorithms, different things that we do in healthcare for over 15 years.
Mm-hmm.
And even though I've just been in social media and speaking for the past, 5 to 7 years, I've always been like, no, why do we have to do it that way? And maybe we are supposed to, but I find myself just wanting to like push against the grain just to make sure, is this what we should be doing? Because they haven't really helped set us up for success when it comes to these types of discussion points.
Again, it really comes back to advocating for yourself, and it ties back because we just had a really great podcast episode where the topic was young onset lung cancer, and the trouble is, of course, the screening guidelines have not caught up to the rise that we're seeing in young lung cancer patients who are not from smoking. And one of the questions we asked was, well, how are folks making the diagnosis? Like, how do you figure this out? And the answer was effectively, you have to stand up for yourself, because when you're coming in saying, I don't know, I've got this cough that's going on forever. And it's so easy, right? Everybody's guilty to say it's probably a virus, give it another couple weeks. Maybe it's just hanging around. And it's like, maybe it's not. Like, maybe it's a tiny lung nodule that was missed. Maybe we need to get that CT that's not in the guidelines. And it's really about advocating for yourself, advocating for your family. I'm sure we all have that story, especially you and I being physicians and hearing sometimes the oversights that happen on other things. Like, did they get this lab? Oh, we forgot. We'll put that in. It's like, it's human error, right? It happens, but it's important to be there and be watching that, kind of stay vigilant for yourself and your loved ones.
It is, because to your point, we will say, oh, why didn't they order this? Why didn't they think of this? So one thing that I have found myself doing, especially with my medical students, because I still have medical students and residents that
awesome.
I precept, I am the attending who's known to be like, well, what about this? What about this? And I have them really give me 10 differential diagnoses. And a little bit further, I ask them to share those with their patients. Tell them what you're thinking, because then maybe they're like, well, remember, doc, I had this cough for a long time. I've already done this. I've already done that. Because then that's truly shared decision making. There might be the opportunity to be like, oh, yeah, we should order this.
It sounds like we practice very similarly, because I do the same. Yeah. And I love to say, I'm like, hey, we're getting this kind of weird blood test to make sure you don't have a blood clot, right? But if it's positive, your stay is going to be a lot longer. We got to get this image. And now all of a sudden, when I come back, it's like 2-3 hours later, they're not angry anymore, because they're like, oh, I understand why this took so long. You were being thorough. We did this test. I had to look.
No one's going to be mad about that.
Right? Which is different than you kind of just order it off the bat. They get it from triage, and all of a sudden they're, why am I waiting? I don't need a scan, and like, so I do think sharing with patients can be really powerful.
I agree. When you arm them with what's to come, you are helping them, feel more comfortable, providing better care. And it also helps you as a clinician, because then there's this level of trust, because now they feel like, oh, this doctor's sharing with me what's happening, and I feel better just being a part of this journey.
Absolutely. Yeah. I find that the social media actually is a great avenue, outside of kind of like writing a book of like the secrets of medicine, right? To really help people advocate and understand lab tests. Like, I find that patients will come and watch, and my content is particularly HCP leaning, but people will watch and say, oh, I didn't know about, this is what a lipase is for. I didn't realize that test. I'll see those comments every once in a while. And so people really do cross-listen, cross-talk, if you will, in the comments. And I love seeing that people are really excited about their healthcare. I think we're in a kind of a new generation of interest in health, and folks are taking their own care into their hands, which is great.
Yes.
Yeah.
Jordan,
Dr. Bayo, I'm curious, what advice would you have to other HCPs who are really wanting to use their platform for good and kind of start to talk about some of these topics that others would shy away from? Maybe a fear of like what others would say, their institution peers. What do you have to say to that?
First, I believe in believing in yourself. And I always start with that because when you're on social media, there is a opportunity to build trust, build followers, people who will really take everything you say with compassion, with love, and possibly do something with it. So the first step is really believing in that you can do this, and then thinking about why you want to do this. And I think if you have those two pieces at your core, even when you're talking about topics that might be uncomfortable or topics that you are passionate about and want to help, which might be going against the grain, that can be your North Star and help keep you centered and not keep you and help you not go off track to why you're doing this. Because I think we all have to have a why, whether it's, social media, whether it's this, whether it's what we do every morning when we get dressed, we have to have a why. And that purpose drives us to allow us to put our best foot forward. So any HCP, if there's something you're passionate about, something that you want to get out there, believe in yourself and put it forward, and know when you face challenges or backlash, like all of us have, Dr. Adam, with these weird comments and different things that happen on social media, you know why you're doing it. And
Absolutely.
that, I think, can help push you or propel you forward, because no one can mess or disrupt what you believe in. And that can help you really continue to do what you are meant to do.
Amazing. Incredibly well said. Before we move towards our we always like to make sure that you get to talk about something that you'd like at the end. But the one thing that we didn't get to touch on yet, and I do want to make sure that we get there, is your experience with giving TED Talks, your experience in, I guess we'll call it maternal health as a whole, right? Tell us, and we can stay high level, but you have an incredible story, and the world and the listeners need to hear it once again. Give us a rundown of how you got active in that space and how that has pulled through into your why why you're on social today.
Well, I had the opportunity to do a TEDx. My first one that I did was actually I started the process in 2021. And I found myself just thinking about all the things that I've been passionate about, that I've been advocating for. And I applied to actually do a TEDx. And they said, well, what exactly do you want to talk about? And I said, health equity. I want to talk about race-based algorithms. And a lot of people aren't aware that I was talking about these race-based algorithms before they were actually put out there on social media. And that goes back to the story when I said in med school and residency, I was pushing against it. I was like, why are we treating this group versus another? And with that application, I was able to create my first TEDx titled, Why Don't Blacks Trust the Healthcare System? And it was one of the hardest things I've ever had to do. A lot of people don't know what goes into being able to do a TEDx. Right. And the first one I did in Reno is actually very well known, where several of the speakers actually are put on TED. And this talk ended up being put on TED. And I went through this process of just iteration after iteration. I think there was like 60 of them, and then memorized. It's very important for TEDx Reno that you have your talk memorized. So I did not read off a teleprompter. A lot of people don't know. And it was really just saying it 30 to 40 times a day while working in clinic, while doing everything else. My kiddos probably to this day still know
they have
both of my TEDx. Well. Yes, they could say it, and went on stage and did it. And that really helped open up so many doors to help me continue to advocate. And that helped really propel, because I was doing television before and writing for different publications, but that credibility that TEDx provided was crucial. And then a lot of people don't know this. So I did that TEDx, which I think went live in 2022. And 1 month later, I received an invitation to do a second one. And they said, is there anything else that you'd like to talk about? I was like, yes, there is. And it was about the maternal mortality. And I had almost done it on my first one. But again, when you do a TEDx, it has to be tight. It really has to have a flow.
Mm-hmm.
And the group that helped me, who were just fantastic, they said, there's going to be a time for this where it can stand alone. And I'm so glad I listened, because that's when I was able to talk about my personal story. And, you know, we hear about Black women dying at the highest rate during childbirth or shortly thereafter. And to be somebody who has experienced that, I knew I wanted to get that out, because I felt like my story could help somebody. And so, although it was going to be really difficult to do, basically write 2 TEDx in less than a year, which is what I did. And do 2 of them within that year, I did it because I knew it could possibly help somebody. And nobody was talking about it in this way of beyond just access to care. Because I always say, I'm like, I had the most access in the world, and that didn't help prevent me from almost dying. So I did it. And that talk, the second one, is titled Do No Harm. And it provides solutions. It talks about the Black maternal health crisis that is still happening to this day. And just grateful that it has over 2.1 million views, but it's not the view count that I focus on. It could have saved a life. Every view could be helping a woman, helping a family member, somebody.
Right.
And that's what it's all about for me. It's not about this needing to be me or, you know, kind of the center. It's about helping others. That is why I do what I do. And that's why I believe in what I do. Saying that full circle. And as long as I keep that at the forefront, it helps drive me to what I get to do, the opportunity of what I get to do every day.
Incredibly well said. And for those listening, we will not spoil the story. You absolutely need to go listen to both talks. I have listened to both multiple times, actually, and it will bring you to tears, and it will empower you and really give you a new perspective. So we can certainly link them in the show notes here.
Yes.
Before we go, Dr. Bayo, we always love to say, is there something that you'd like to plug, something exciting coming? And most importantly, where can folks find you?
Yes. Well, first, I always like to end with a level of gratitude for people who know me. First, I just want to extend gratitude to you and Jordan for this opportunity to join. And this has been just a fantastic conversation, and I'm grateful. You can find me on socials at dr.bio, of course, on Instagram and TikTok, on YouTube, and of course on LinkedIn as well. And my 2 TEDx talks, Do No Harm and Why Don't Blacks Trust the Healthcare System. I do have several things that are in the pipeline. One is I have received the opportunity or the invitation to speak at South by Southwest again. So I spoke last year, and I found out that I'll be speaking again.
Very
also,
exciting.
I have a couple speaking engagements that are in the pipeline. And then I recently received an interview from the New Yorker, and I'm in the cut. So please take a look at that. And then some other television and literacy opportunities that are happening. So I'll just pepper that in there, and grateful. Every opportunity that I receive, there is just a level of just grateful. And I'm going to keep pushing, keep advocating, and just keep going with this journey. And I'm so appreciative of everyone who has believed in me. And I want to give you a shout out to Dr. Adam. When an email came through and you didn't even know who I was, but you took the time and leaned into that curiosity to know more about me. And I appreciate you very, very much because you have helped me really touch more lives, help more people through this partnership. And I just want to let you know that I'm grateful.
Well, I genuinely appreciate that. We appreciate you coming on. Always a pleasure to speak with you, Dr. Bayo. You are welcome back on the show anytime. probably one of our most engaging episodes. Really, we have gone all over. So thank you again for joining us. You all have heard where to find Dr. Bayo. Thank you again for joining us, and have a great rest of your day.
Thank you.
You're amazing. Thank you.